Disorders of fluids and electrolytes, molecular physiology of water balance. First, the definition. The regulation of water balance is governed by a high-gain feedback mechanism involving the hypothalamus, the neurohypophysis, and the kidneys. Osmoreceptors in the hypothalamus, which originally were described by Bernie, sense plus osmolality. The molecular mechanism of osmosensing has recently been described by Dassinger and Seid. It is in part dependent on activation of non-selective calcium-permeable ketone channels in homosensing neurons that can serve as stretch receptors. A video about electrolyte imbalance treatment and symptoms.
Electrolytes play a vital role in maintaining homeostasis within the body. They help to regulate myocardial and neurological function, fluid balance, oxygen delivery, acid-base balance, and much more. The most common cause of electrolyte disturbances is renal failure. Electrolyte imbalance symptoms: dizziness, fatigue, nausea with or without vomiting, trembling, constipation, dark urine, decreased urine output, dry mouth and foul breath, dry skin, lack of perspiration, muscle weakness, stiff or aching joints. Treatment of an electrolyte imbalance: identifying and treating the underlying problem causing the electrolyte imbalance. Intravenous fluids, electrolyte replacement. A minor electrolyte imbalance may be corrected by diet changes. Electrolyte imbalance is a common disease, yet every individual needs unique treatment and care. We encourage people with electrolyte imbalance and their families to learn as much as possible about the latest medical treatment and approaches, as well as healthy lifestyle choices. For more information about electrolyte imbalance,
Increased renal reabsorption of water in response to vasopressin lowered plasma osmolality, thereby reducing the stimulus for vasopressin secreting anthers and completing the feedback loop. A video about fluids and electrolytes balance. Electrolytes in balance.
This program will discuss imbalances in some of the main electrolytes in the body. The electrolyte balance in the body's fluids is absolutely crucial to many body processes, and any imbalances can cause serious disorders and can even be life-threatening. As described in an earlier program, the fluids in the body are filled with dissolved salts and minerals that take on plus or minus electrical charges and are called ions or electrolytes. The common electrolytes sodium, potassium, and calcium take on positive charges in a fluid and are called cations. And chloride, bicarbonate, and phosphate take on negative charges and are called anions. The concentrations and charges of these electrolytes have a lot to do with how fluids move through the body and how they pass through the membranes into and out of cells and blood vessels. Osmosis, diffusion, and active transport are all processes of fluid transfer through membranes that are dependent on the concentrations of electrolytes. Imbalances in electrolytes can disrupt this flow of fluids and cause many pathological conditions. The body's cells feed themselves, rid themselves of wastes, and send and receive chemical substances from all around the body. Much of this complex fluid transportation network is controlled by electrolytes and how they influence the movement of fluids through membranes. First, we will discuss sodium.
Application on medicine. There are many causes electrolyte imbalance, including loss of body fluids from prolonged vomiting, diarrhea, sweating, of high fever, poor diet, and lack of vitamins from food. Malabsorption, the body cannot absorb these electrolytes due to various stomach disorders, drugs, or the way in which food is consumed. Endocrine or hormonal disorders, kidney disease, a complication of chemotherapy is tumor lysis syndrome. This occurs when the body quickly destroys tumor cells after chemotherapy, and low calcium levels in blood increases blood levels of potassium and other electrolyte abnormalities occur. Certain medication can cause an electrolyte imbalance such as chemotherapy drugs, diuretics, antibiotics, and corticosteroids. The aquaporins channel membrane for water. Aquaporins are a family of intrinsic membrane proteins that function as water selective channel and mediate the transport of water through the plasma membrane of cells. The first identified aquaporin, chip 20A, either called aquaporin chip or just aquaporin 1, was purified by agree in human erythrocytes in the 18th. To date, we have identified 11 water channel proteins in mammalian tissues which have been called aquaporin or consecutively to aquaporin. The main electrolyte disturbances are by altering the water, dehydration and fluid overload, edema, by altering the sodium, hyponatremia and hypernatremia, by altering potassium, and hyperkalemia, by altering the chlorine, hypochloremia and hyperchloremia, by altering the calcium, hypocalcemia and hypercalcemia, by altering the match, hypophosphatemia and hyperphosphatemia, by an hypermagnesemia, and by alteration in acid-base balance, acidosis, and alkalosis. A video about fluids and electrolyte bases.
Basis of life. Water makes up about 60% of the average human body by weight. All the time, fluid is being drained out of the body through the skin and perspiration, through the digestive tract, the urinary tract, and breathed out as moisture through the lungs. Meanwhile, fluid is constantly being replenished in the body, primarily by drinking and eating to maintain a balance. Many fluids also contain substances called electrolytes, salts and minerals that are electrically charged when they're dissolved in the liquid. The balance of these electrolytes in the body is essential to most body processes, such as stretching a muscle. A third fluid balance essential to life is the balance between acid and base. If this balance is badly upset, it can kill. All of these balances must be maintained for the body to function normally and maintain health.
Or restrict the intake of water if the sodium level in the blood is low. Video about water electrolyte imbalance medical condition. conclusion is agents that block water channels, aquaporins, urea channels are not currently available. However, the important role of these channels in normal water balance suggests that agents which are currently under development may be useful in the treatment of water balance disorder. The last video about electrolyte imbalance.
Hi, my name is Herbert Morrow.
Hi, my name is Garrett Mishell.
Today we would like to talk to you about electrolyte imbalance.
Aw shucks, Herbert, let's just sit here and drink. Then we can show them electrolyte imbalance related to intoxication. Ha, ha, ha.
Now Garrett, you know Mrs. Gonzalez would not like that very much. Alright. As I was saying, we are going to discuss electrolyte imbalance.
Okay, I suppose you are right. Bartender, pour me another shot of whiskey, and bring him a Shirley Temple. This is gonna take a while.
Oh dear, it appears I will have to be the designated driver again. I just hope he doesn't end up like the girl on Anna's birthday cake.
Hashtag, whatever.
Alright, electrolytes are substances